prevent the outbreak, prevent what we're seeing in New York City. Prevent what we're starting, the kind of things that we go. I think we can avoid that. We'll be much different than what we're doing right now.
Absolutely. So ask, or standards surgical supply, we need more.
We have much more supply now than we had just literally a week or two ago. You have to prioritize who needs the mask and who should wear it.
Okay.
First and foremost, healthcare providers, doctors, nurses, and health providers who are taking care of a person with coronavirus disease to protect them from getting infected. Because what's happened in Italy and what happened in China is you can knock out your healthcare force and then you're really in trouble. So protect the person. The other one is if you are infected, to put a mask on to prevent you from spreading it to someone else. The third priority is the general population, who, if they wear a mask, they may assume that it's 100% protected. It's just not. It's probably, you can guess a number, maybe 50%. So when we say you don't need to wear a mask, what we're really saying is that make sure you prioritize it first to the people who need the mask. In a perfect world, if you had all the masks you wanted, then somebody walking in the street with a mask doesn't bother me. You can get some degree of protection, but make sure you prioritize it well.
And I was just thinking about like all the different, ways to address that issue. Obviously, there's, the federal government down to, your state governments trying to, I heard that a lot of state governments are having to go buy them on their own and try to, supply those to, like you said, where it's needed. Are we going about that the right way in terms of, that process and getting that access and just?
Yeah, there's a stockpile.
We don't have a lot of visibility. Yeah.
Steph, there's a stockpile of, tens and tens of millions of masks. But, we live in a country that we can do things pretty efficiently. Once you get the private sector, these companies involved, they could whip out millions and millions of masks. So, I mean, literally at the last meeting we had, say, okay, enough is enough. Let's get them and flood it. Let's get those companies to make them. And they're willing to do it. It's very interesting. You would think that the federal government would almost have to force them to do it. Right. We're not seeing that. We're seeing they're stepping forward, wanting to do it themselves.
I appreciate that. Just from your vantage point, you've been front and center from the start, again, spreading, accurate, truthful information and trying to, I know things change on the daily and you're following that trend, but what's the biggest piece of, I guess, misinformation and that that's kind of been out and, for public consumption, and what would you kind of say to correct that whatever issue that is?
I think you brought it up in one of the questions that you asked me, this dichotomy between people who are being frightened to death of it versus people who don't even believe it and think it's something trivial that you don't have to worry about. I'd like to get the people in the country to realize that we are dealing with a serious problem. It's something that we've modified our lives. It's not convenient to lock yourself in. It's not convenient to not do the kinds of things. It's not convenient for you not to be playing basketball. But we're going through a period of time now where we've got to, as a country, pull together, don't get frightened, don't get intimidated, use the energy to be able to confront it and do the kinds of things that'll put an end to it. So I want to get rid of that misconception that there's extremes. Either the world is going to end or we don't want to do anything. It isn't that. It's somewhere in the middle.
I appreciate it. I think that's what we all needed to hear. It's what, the reason I wanted to do this and be able to have this FaceTime with you, just because from when anybody's life is interrupted, and whether you've been affected personally by COVID or not, from somebody contracting the virus or what have you, that level of comfort that what we're doing is, what we're doing is in the right spirit of trying to stop the spread as fast as possible, return people to their normal lives, but, taking this seriously and understand that there is a strategy to doing that, and that we all kind of have to adhere to it. So just in that respect, like, where would you send, your everyday person to find that information if we can't get on an IG live and ask these questions? Like, where would you send them to stay in the know?
Yeah, well, there's a couple of websites. There's one called coronavirus.gov. It's part of the CDC website. You could either go into cdc.gov and get into it, or go right to coronavirus.gov. All the information you want is right there.
Perfect. We're going to save this this Q&A, and hopefully people can go back to it and get all that pertinent information. I appreciate you so much for being available and being selfless enough to have this conversation with me. And thank you again for you and your entire team protecting all of us. And can't thank you enough.
Thank you very much, Steph. It's a pleasure being with you. Thank you for giving me the opportunity to be with you.
Absolutely. All the best.
Thank you.